Hey everyone, and welcome back to Sugar Pills, a practical guide to self-care. So if you're listening on the podcast, be sure to follow this podcast, subscribe, and share with a couple of friends, and give us a rate and review, and we will send you a free self-care goodie. Also, if you're watching this on the YouTube channel, be sure to subscribe and like. It really helps me with the algorithm and bring you guys amazing content. So without further ado, I would like to introduce our guest today, whom I'm super excited to speak with, especially regarding some of the things that us girls talk about behind closed doors and sort of getting the shame and stigma out of it. So everyone listening, please welcome Dr. Steve Yu. He's a Southern California-based surgeon specializing in minimally invasive gynecological surgery, or MIGS, and vaginal rejuvenation at the Rox Surgery Center in Newport Beach. In 2008, he finished his residency at Case Western Reserve University, one of the nation's leading research universities. He took his expertise in MIGS to UCLA, where he worked as an associate professor. Dr. Yu's also experienced in vaginal rejuvenation and minimally invasive treatment for urinary incontinence. We'll get into all of that during our time together. A native of California, Dr. Yu spends his leisure time cycling, surfing, and MMA. And if you guys can see him, he has some cool tats. So just because he's a surgeon, that doesn't mean he doesn't have his own personal life. And we could talk about that as well. And he also enjoys his 2 boys. Another passion for Dr. Yu is cooking for friends and family at home in his professional kitchen and 2 outdoor kitchens. And that I'm super excited about. Who doesn't want to cook and get into it? So thank you so much, Dr. Yu, for joining us.
Well, thank you. Thank you very much for having me.
Yeah. So I think we could kick off with maybe explaining what minimal invasive surgery is. I know we've said a lot of big words, a lot of buzzwords. So for everyone listening, can you just break down what exactly that is versus maybe a more invasive surgery?
Yeah, sure. So traditionally, most surgeries and most gynecologic surgeries have been done what we call open or abdominal, which means through a large incision. So, for example, my own mother has had a hysterectomy, and they made an incision from her belly button all the way down to her pubis. So we're talking a huge incision. And so now, with the advent of and the advances in like fiber optic cameras, we can make tiny incision, usually hidden in the umbilicus, and we can go in with a camera and do all the surgeries that we used to do with big, large incisions. So mainly that's what's called minimally invasive. And also, with the advent of the camera as well, we can go in and take care of problems that are in the inside cavity of the uterus without making any incisions at all.
That's great. And particularly being a woman of color, and I know a lot of women of color, when we have surgery or anything that's invasive or scars our tissue, it will keloid. So is this a really good option to prevent that from happening to particularly women of color? And I know that we'll also be talking about fibroids, which I know also disproportionately affects women of color as well.
Yes, for keloiding, very much true. I mean, if we're talking about an incision that could be greater than a foot long traditionally, when we're making incisions about 1 centimeter or less, greatly minimize the chance of having keloids. Absolutely.
Yeah, so that's definitely something that we should think about. And then as we were talking about fibroids, over 26 million women between the ages of 15 and 50 have uterine fibroids. So I first wanted to see what are some of the symptoms that we should be looking out for that we may not know might be caused by uterine fibroids.
Well, some of the most common symptoms would be heavy menstrual bleeding. And if it grows large enough, the woman will have bulk symptoms. And what I mean by that is, for example, let's say the fibroid is pressing on the bladder. Well, the bladder has a very elastic skin to it. And if it stretches or if you push the bladder at all, that sends a neural message to your brain saying that I have to urinate. So women with urinary frequency, one of the causes may be a fibroid that's pressing on it. Many times women have lower back problems, and if the fibroid is pressing against what we call the sacral plexus, where all the nerves are, that can cause back issues. And if it really just gets really too large, they have very much pain and discomfort with intercourse. And at some point, it starts to show if it gets larger, and they appear as if they're pregnant.
Wow. So if we as women, if we have those symptoms and say we do go to our doctor and we're diagnosed with having fibroids, like I know you just talked about your mother having a hysterectomy, which then renders us sterile or no longer to have children, and just other complications that can go along with that. So what are some alternatives that you have come up with and for us if we find ourselves in that unfortunate position where we're facing uterine fibroids and we're weighing the decisions on the best way to heal ourselves?
Yeah, so my entire practice philosophy and my career-long work is in uterine sparing, minimally invasive surgery. So I try to avoid hysterectomy almost at all cost. Of course, there are certain very few absolute indications for a hysterectomy, but vast majority of the time, a hysterectomy does not have to be done. So some of the alternatives would be removing the fibroid. So another word for a fibroid is a myoma, and ectomy means to remove. So I perform a lot of myomectomies. And again, traditionally, most myomectomies were performed with a large incision, and we call those abdominal myomectomies. But I perform these laparoscopic, which is through a tiny camera through the belly. We also perform this hysteroscopic, which is with no incisions at all, and going straight in through the cervical canal and into the uterine cavity if the fibroid is there in that location. And we also perform robotically. There are other ways of treating fibroids without removing them at all. There is a relatively new procedure called Acessa, which is a type of laparoscopic surgery, but we use a small needle to go inside of the fibroid, and it's ultrasound guided, so it just tells us exactly where we're at. And we deploy an array, which kind of looks like fingers coming out at you. And these tiny arrays go inside of the fibroid and heats the fibroid. And using an energy source called radio frequency, we melt the fibroid. So the fibroid doesn't go away, but it prevents it from growing. And we often see about a 50% shrinkage in the fibroid. So that's another method. Other methods for women who are done childbearing are procedures such as uterine artery embolization. And there's other procedures called a focused high frequency ultrasounds that can do it as well. And we have a slew of medications that can also treat fibroids.
No, that's really great to know. And then, so just for everyone who's listening, if you do find yourself facing that, know that a hysterectomy should be the last resort and not the first resort. And as Dr. Yu went through for us, various options of less invasive and more minimally invasive options that you have. So if you have a doctor and their sort of default is that, I would definitely suggest reach out to Dr. Yu. All of his contact information is in the show notes, and he's located in Newport Beach, but everything is digital and online. So even if you're not there, feel free to call the office or shoot them an email. We'll have all of their contact information in the show notes. But just know if you find yourself facing this, hysterectomy is the last resort, not the first one. And we've had everything that he said. We could have the robot go in, we could have the cameras go in, we could do the Acessa, I believe that's what it was called. Go in, or can go in and essentially heat the fibroid to not erase it, but to minimize it, to shrink it, to get it smaller and to stop it from growing. So there are a lot of options out there prior to doing a hysterectomy. And so,
Yeah, so while we're talking about hysterectomy, I just want you and our audience to know that in our nation, there are over 600,000 hysterectomies that are performed every year. That's only second to a cesarean section. So that's the second most common surgery that a woman receives. And vast majority, over 90% of the time, it's not due to cancerous reasons, which means most of those times it could be avoided.
Mm-hmm.
And there are consequences to a hysterectomy that we've learned over the past 5 years or so that we haven't learned before. Although the ovary receives its own blood supply, and we're not talking about removing the ovary at this point, the ovaries are connected to the uterus. And then the thought is it's getting some of its blood supply from the uterus. So if you perform a hysterectomy, now we're learning that women go into menopause 3.7, almost 4 years sooner than their natural time. Mm-hmm. And after a menopause, women have a whole slew of medical consequences that we're learning now that we've never known before. Another staggering fact that I like to add is that once a woman has surgery to get a hysterectomy, depending on what study you read, 40 to 70% of the time, the doctor will remove a woman's ovaries for no reason at all. And that to me is staggering. That puts the woman just straight into menopause.
Yeah.
And often this is done when women are in their 30s or 40s.
Wow. Yeah. And I think you bring up a lot of really great points that we should highlight, because I know I'm learning as you're speaking. So I want to make sure that everyone listening is catching these gems that you've been dropping. I think the first one is that great distinction between exactly what a hysterectomy should be and what it shouldn't be. So it shouldn't be removing the uterus and the ovaries. The procedure really should just be removing the uterus.
Yes, that's correct. That's correct. But often when that's scheduled, mm-hmm. A surgeon will just kind of have this mentality. Well, since we're in there, we should remove the ovaries too. And that practice is still going on today. Let me just counter that to a man. I don't know a single man out there that has had their testes removed. A man could have testicular cancer, mm-hmm. and the first thing that the oncologist or the urologist would do would not be to remove the testes. They'll try chemotherapy first. They'll try everything to save a man's testes. Contrast that to a woman. We see women getting their ovaries removed all the time for very little to no reason at all. So yeah. That's just one point one message that I like to send.
I love that. And not to get too deep into it, but just what came up for me when you were talking. Do you think a large part of that is because the majority of the surgeons doing these procedures are men? So they don't have the lived experience of what it means to be a woman and to have the hormones and everything that happens within the woman's physical body. So they identify with men more because they can empathize in being in that situation where it's like, if it were my testes, I want to make sure I do everything I can to save them, because they see the value in that and they've had that lived experience, whereas they may not have that same lived experience as a woman would. And so I think it could be that. It could be like unconscious, not sexual, but like sexist biased. It's not intentional, but it's, oh, well, we're in here, yes, to yank them out. They don't have it. They don't know what that repercussions physically feels like in that lived experience. And then I also think, just hearing you talk about it, just for my own knowledge and for everyone listening, women, it's a really good reminder to be your own self-advocate. Do your research, talk to knowledgeable and compassionate doctors like Dr. Steve Yu, talk to the doctors who have a holistic perspective on like the female body and the male body. And he is totally an expert in this space, so that, well, what should a hysterectomy actually be? And then with your doctor, if it's not Dr. Steve Yu, which it should be, but just in case it's not, you can then go in and say, hey, I know what this procedure is, and these are the things I'm consenting to. So when you get in there, you do not have my consent to randomly remove my ovaries just because I'm opened up on the slab or on the table. These are the exact things that I'm consenting to. So educate yourself, find a doctor that is knowledgeable and compassionate, Dr. Steve Yu or someone like him, and then be your own advocate and know exactly what you are and are not consenting to before you go under the knife. So I think that's a really good reminder, because I don't think I knew that a hysterectomy wouldn't take the ovaries. I knew it was the uterus, but I think in my mind I sort of I know the difference, but I sort of equated the two, if that makes sense. That's right, everyone. So just be your own self advocate and find compassionate and knowledgeable doctors like Steve Yu. And speaking of being knowledgeable, compassionate, and learning about new procedures, one procedure that I heard about based on the Real Housewives is vaginal rejuvenation. Like, I've actually partnered with Vicki Gumbelson, who's on the Real Housewives of the OC. And I know she's talked about it. I know other housewives have talked about it as well. So do you want to kind of explain to us what that is, and to get some true knowledge, not just sort of the pop culture knowledge that we get about it?
Sure. And this is another subject I feel very passionate about, because it's really through my education and my kind of evolution, not only as a physician, but as an individual, where my attitude about it has changed drastically. When I was an associate professor at UCLA, a very academic center, we used to view doctors doing this in Newport Beach, Beverly Hills, and we used to kind of frown upon this, largely due to our ignorance. And what has really changed my mind is that if you're doing something that is really benefiting and affecting a woman's lives in a positive way and changing their whole outlook and their quality of life, and due to that reason, I believe that it is a very important surgery for the select candidates who would actually benefit from it. So there's many things that are kind of clumped into this umbrella term of vaginal rejuvenation. The simplest would be a labiaplasty. So the labia minora, a lot of women are not happy with the appearance of it. Either it's too long or shaped irregularly, or sometimes it's long and women have problem exercising, wearing tight clothing, intercourse can become uncomfortable. So we can trim it to the shape and size that's comfortable for the woman. We can also do that for the labia majora, which is kind of the outer part, which is the hair-bearing part as well. Another thing that we do for a vaginal rejuvenation, if they're candidates, it's often after childbearing, a woman will complain that they're not tight enough. So we can tighten not just the opening, but we can repair the, let me back up a step. After childbirth, sometimes what could happen is the woman could have a pelvic organ prolapse. So that's either their bladder or their rectum protruding out of their vaginas. So we can reconstruct the entire inside to make it a normal vaginal canal again. And if they want tightening involved in that, we can do that as well.
Wow.
So,
yeah.
Yes.
Yeah, that last one kind of like took me for a shock. Like, I'm not a mother, I've never given birth. So having all of the postpartum things that happen to your body can be a little intimidating, but it's great to know that when that happens, there are doctors like you who are able to help us with that. And I would totally agree with what you're saying. I think that there was two things around it. I think it was shame and stigma. So there was sort of this, I think for the women at least, there was shame around talking about, what does my vagina look like? Why does that matter? Like, what is the quality of my sex life? And, there's like a shame around and embarrassment sort of talking about that. And then I think the stigma came with how it always is, talking around women's reproductive products and sexual products. So I think that it was a big combination between shame and stigma. So I think it's great that you are sort of debunking those things and you're normalizing a woman having the choice to say, hey, I want my body to look this way and I want to be able to enjoy certain activities that are supposed to be pleasurable as well for me as well as for my partner. So I think it's really great that you are doing that. And I think my perspective on like any plastic surgery or elective surgery, that always is kind of subjective, because for some person it might not be elective to them. It might really be something that will add to the quality of your life. And I think that kind of redefining what that means is important in this space, because if my well-being to me is really important, then this, surgery isn't elective. To me, it's something that I really want to do. So with that, I know that with plastic surgery, they do a lot of consultations around body dysmorphia. They want to make sure that people aren't, you're going in for maybe like a little bit of a nose shave, but then you end up having 20, 30, 50 surgeries, and it just kind of gets out of hand. So what does that consultation look like with the person who wants to do a vaginal rejuvenation, to make sure that their mindset is in the right place, where it's, hey, this is my body. This is just something that I personally want to do to feel better about myself. I'm already confident, but this is just my choice for me, versus someone who might be suffering from like a body dysmorphia, or maybe another issue where they're using the surgery sort of as a Band-Aid, and it's a symptom of something bigger than what it should be.
Fortunately, for my job, it's a little bit easier than trying to address somebody with a body dysmorphic issue. So, my consultations are an hour long. I sit down with the patient in my office, really just try to get to know them and see what's really bothering them. And during the examination, they tell me exactly what they're not happy with, and they tell me how they would want it to appear. So it's usually a labiaplasty. And there are times where patients will say, well, I want a lot of it trimmed off. And there are some surgeries that I refuse to do, because I have to explain to our patients that, well, you need some of the labia minora there. It serves a function, it serves a purpose. It keeps the vagina moist, it keeps it non-irritated. So sometimes patients want things that I think medically it's not beneficial for them. So for those patients, I would educate them, and I would steer them away from doing that type of surgery. Other cases is pretty straightforward. I examine them and their bladder's coming out, that needs to be fixed. So, that's not cosmetic at all. It's a medically necessary surgery. And likewise, if the rectum's coming out, that needs to be addressed. So a lot of times it's not really dealing with body dysmorphism. It's just really seeing what they want and seeing how that can benefit their lives. And another thing that we don't talk about a lot is, as women age, as we all age, really, skin tends to sag a little bit. So for our older population, the labia majora, the outer part, the hair-bearing part, tends to kind of be saggy, just like, well, trust me, men are the same way in other parts,
Yeah.
We all are as we age. And if they want some of that skin reduced for their own self-confidence, and I feel that it's going to cause absolutely no medical harm or dysfunction in their daily lives, then I'll be happy to perform that type of procedure for them.
Yeah. It's good to hear that you have a clear point of view and perspective when you have people come in, and it's very, what are you looking for? What will make you happy? And then let's just look at what actually is going on, and then find the best solution for you. So I love that. And then again, the situation with the rectum or the bladder coming out, that to me just like blows my mind that happens to like women's bodies. And it's just a good reminder to educate ourselves more on what can happen to the body, and to be ashamed to speak up and to ask questions and to be vulnerable. because I'm like, how come I'm just hearing about this? I have 4 sisters. I have a mother. I have so many friends. Like, a lot of them have children, and I'm sure a lot of them are probably suffering in silence, or they got it done, but they're not talking about it. So it goes back to that shame aspect of it, where you can be surrounded by women who all have had children, and I'm sure their body has had different things happen to it, but no one's talking about it. So I think it's really good to have those conversations, because then you even realize, like, there are options. Like, well, did you know that there is something called vaginal rejuvenation? If this is, hindering the quality of, your life, there are actually options for you, because people may not even know about it. So what are some other things that people come in your office for that there might be embarrassment around? Like, I think it was vaginal incontinence, or urinary incontinence and things like that. So what are some other things that we should be talking about, but we're not talking about them enough?
Sure. I mean, this is actually, in my opinion, a far more common issue that women just learn how to deal with. And just kind of stepping back one moment, I think why so many women would just allow their doctors to perform a hysterectomy is because, and the question of, you had an earlier question, why is that happening? Is it because it's the male-dominated field? Well, I think that is really multifactorial. It's a very, very interesting question.
Mm-hmm.
Well, now OBGYN is not a male-dominated field. Most of our new grads are women. But historically, you're very correct. All of the OBGYNs were male. Mm-hmm. And so why are we just removing uterus and performing so many hysterectomies? I think one is just primitive knowledge, lack of training, and just really, and it's been like that for years. So it sounds like a tradition where women even now say, well, my grandma had a hysterectomy, my mother had a hysterectomy, so I think it's okay if I just go have a hysterectomy.
Right.
Maybe some of that has to do with, when it was a male-dominated specialty, where men maybe just did not value or didn't understand what they were doing when they were removing uterus and ovaries, and without really thinking about the health consequences.
Right.
So I'm just going to kind of segue back into our conversation now with the urinary incontinence. What my point here is, I think because so many women have it, and they feel that it's okay, it's just part of aging, or this is just what happens when after I have a child. And often patients will ask me, is this normal? And and the answer is no.
No. And can you explain what it is? Because I'm not 100% sure I know exactly what it is. So can you explain it? Because maybe we're out here suffering from it and we don't have the language to say what it is.
Exactly. So it's medically called SUI, so stress urinary incontinence.
Okay.
So stress, it means if there's any kind of maneuver that puts any kind of stress on the bladder, such as sneezing, laughing, running, jogging, exercising, that a woman will leak urine.
Yeah.
So we know it's very prevalent, or else manufacturers would not be making adult diapers, such as the pens and products like that, right? And then, these commercials and it's just sending a message out that, hey, this is normal, it's okay. This is kind of what happens when you age, and this is kind of what happens if you have kids. And so my message to women is that it's not normal. It's common, but it's not normal, and you don't have to live that way. So that's what stress urinary incontinence is.
Yeah, thank you so much, because I didn't know exactly what the technical language and terms were, but when you described it, I was like, oh yeah, every woman talks about that. Like, oops, I sneezed, guys. And it's like, we're at spin class and it's not just sweat. Like, you know what I mean? It's like, the struggle is real.
Right.
You're 100% correct. The narrative around that has always been, oh, that's just how it is. Like, oh, I popped out 2 kids. Oh, I'm getting older. Oh, this is it. And when you're talking about the commercials for the Depends and things like that, just from a capitalistic, almost commercial perspective, it's better for these businesses to keep women thinking that it's normal, because then they can sell all these products. But if I can go to Dr. Steve Yu, get it fixed up, then I no longer need to buy and purchase all of these products. And it's no longer something that women just accept as part of being a woman. And I think it's really, another thing that you said that I think was really insightful is that it's not normal. Like, just because something happens a lot, or it's just because something is common doesn't mean it's normal. And I think that was a really great distinction, because when it becomes common in our minds, we normalize it. Like, yeah, like my grandma, when she sneezes, oh, my mom popped out some kids, when it happens to her, my good girlfriend, when we're doing yoga, her pants are a little wet, it's just sort of, it became normalized, but having that happen to you actually isn't normal. And so I think it's really great that you made that distinction. I know I didn't know that distinction. I know I thought it was just like, oh yeah, that's going to happen in like 10 years, or, that's going to happen
Right.
XYZ. And it's good to know that there are options out there for us, and that as women, we don't have to sort of just sneeze and cycle and pee in silence and all of those things. And I think it's also a good indicator that if that is happening, since just because it's common doesn't mean it's normal, to get checked out and to be honest with your doctor that that's happening to you, because maybe it is indicative of a bigger problem that's going on. Maybe it means that you do have like fibroids on your bladder and you don't know, and you're peeing all the time and you just think it's normal. Everyone pees a little bit when they laugh, or or whatever the case may be, that if that's happening to you, it's not normal and you should get it looked at, and it is treatable as well. So I think those are some really, really good insights and distinctions to know. 100%. And I know I've learned so much, even as a woman, I've just learned, well, you're a doctor, so, but yeah, but I've learned just so much in this time that we've had together. So I just thank you so much for your insights. And I also really thank you for your compassion. You seem like a very compassionate doctor, that you think more about your patient's overall well-being, and whether or not this procedure is right for this particular patient. Sometimes, particularly like I live in LA, so like I know like the Beverly Hills, Newport area, sometimes it can be almost cookie cutter. Like everyone's like, oh, I want the Kardashian lips, or I want the Brazilian butt, or I want this, and this. But what I love about your practice is that you seem to really care about the individual patient and what is that individual patient's unique needs for their particular life, rather than like, give me Angelina Jolie cheeks or whatever it is. So that's been really refreshing, and thank you for having that compassion for your patients.
Oh, yeah, absolutely. I feel that part of my surgical consultation is not figuring out what the patient needs. It's also figuring out who does not need surgery at all, and educating them why about that reason. And just while we're talking about the urinary incontinence,
yeah.
One thing that I like to add is currently the vast majority of procedures are done to correct urinary incontinence uses a vaginal mesh material. I mean, have you heard of that? And have you heard of the lawyer commercials talking about suing their doctors about the mesh, vaginal mesh? I'm sure you've heard of that.
Join our class action.
Right, exactly. So, I do a minimally invasive procedure that uses no mesh material at all to fix the incontinence. So that's one message that I would like to send out, is not all incontinence procedures, surgeries have to involve the mesh.
That's good. That's good to know. And if you think about it, just hearing the word mesh and vagina, to me, it's like, to me, I'm like, mesh. I want like a mesh fabric dress. Like, not
there you go. Yeah.
Permanently going inside of me or things like that. But I just also wanted to quickly recap some of the key takeaways and insights that I learned from you, and I hope everyone listening has as well. I think the first one was really have the invasive surgeries be your last resort, not your first resort. So if you are getting guidance that you need a hysterectomy, or you need the mesh, or you need these, really big, scary, invasive surgeries, take a step back, educate yourself, find an expert in the space that is knowledgeable and compassionate, just like Dr. Steve Yu, and then be your own best self advocate. Find out what the options are for something that is minimally invasive. You always want to start with the least invasive, and then unfortunately, if it has to escalate, then escalate to the next step, but always have those bigger surgeries as a last resort, not the first default. Also, I love that you talked about the different ways that we can treat fibroids. You gave us a couple of different ways. One was robotic, one was with the camera, another one was with the heat. That doesn't eliminate, but it shrinks the fibroid and keeps it from getting bigger. So there are options when it comes to that. I also love that you broke down the difference between what a hysterectomy should be and what it shouldn't be. It's the removing of the uterus. So be sure that when you talk to your doctor, that they just don't have sort of free will to remove your ovaries as well, because if that happens, you can have greater health repercussions down the line. Also, another thing that we touched upon that I thought was really great was the male dominated surgical or medical industry, but there's more women coming into the fold. So just maybe if you're a woman, look for a woman, or look for a compassionate and knowledgeable man. And then again, always just like be your own best advocate. And then taking back the shame and stigma when it comes to our vaginal health, whether that's vaginal rejuvenation, if you want to get, your inner lips, your outer lips, you want to get them, kind of taken, shaved off, or taken back just for your own quality of life. Or if you've had a child and you have sort of some stuff going on there with the rectum or the bladder, you have options, and you shouldn't feel ashamed for wanting those options. And we should take away that stigma. I think women, we're allowed to want our body to look a certain way, and we should also want to have sexual pleasure as well. So if those things are available to us, why not try them? So we kind of need to peel back the stigma and the shame around vaginal rejuvenation and any vaginal surgeries in that area. And then another thing that we touched upon was also removing the normalization around urinary incontinence, which is, if you sneeze and you pee a little bit, or if you're on the bus and you jig a little away and like if the pee comes out, or if you're biking or exercising, or just, moving your body in certain unexpected ways and you kind of pee a little bit, that has unfortunately been normalized, but it's not actually normal for the body, even though it's common. So we need to start speaking up. We need to start talking to each other. We need to start talking to our doctors, making sure that we're saying that, if you go to your, annual, or if you go to your doctor, make sure to say, if you're experiencing that, put that down as a symptom, because sometimes when we think things are normal, we don't think of it as a symptom. So you may not go to the doctor and let them know, hey, sometimes when I sneeze or something happens, little pee comes out. If you think that's normal, it may not occur to you to tell your doctor that's happening, right? So we'll have the awareness that that's not normal and it's not a sign of a healthy body. So be sure to write that down as a symptom, and to be transparent with your doctor that is happening to you, because it could be a sign of something bigger. Or you could just do, like Dr. Steve, you said, a minimally invasive surgery just to, get rid of it. And you don't have to live wearing Depends or panty liners or wet spots in your yoga pants. Like, there's a better way to live, ladies. So I think those were the key highlights and insights that I had. Again, in the show notes, we have all the information for Dr. Steve Yu for you to connect with him and talk to him. And as you can see, he is knowledgeable and compassionate. So Dr. Steve Yu, did I miss anything? Is there anything more you want to add?
You know what? You've really summarized it quite well. The only thing I have to add to that is, often unfortunately, us, the consumers, we don't know who's a good surgeon or who's not. And I'm reading all the Yelp reviews or whatever, that doesn't really help. And another thing is, often trying to get into a doctor's appointment, we have to wait weeks. So the first doctor we see, we kind of cling on to them, especially when we're desperate with a problem. But I would just really encourage women to find a doctor, whether it's a second or third opinion, someone that they connect with, and ask the difficult question. Are you an expert in that particular surgery or that particular issue? And when patients ask me, and when I'm not, I'm just open and honest. No, I'm not an expert in X, Y, and whatever they're looking for, but I'll refer them to who are experts in that. And there's no shame in asking how many of these procedures, asking the doctor, how many of these procedures have you performed? So our specialty is MIGS, again, as you said, minimally invasive gynecologic surgery. This is the first year where ABOG, which is the American Board of Obstetrics and Gynecology, that's our medical board, has offered experienced surgeons who have met the prerequisites to take an examination to be recognized as an expert, as a mixed surgeon. This is the first year that it's happened.
Wow.
So maybe that's a question that that our audience could ask their doctors. Are you a MIGS? It's called a focus practice, and are you recognized by the American Board of Obstetrics and Gynecologists of having this recognition? So this year was the first year that it was offered. I was the first group of physicians who have passed that examination. So not that that's so important, but I think the more important question is that our patients find the doctors that they're comfortable with and ask them the difficult question. Are you an expert in that particular thing?
Yeah. No, I think that's great advice. Like, I don't know, it's a little tangential, but have you listened to or seen Dr. Death, the podcast? Never mind. But it's along these lines where there's this surgeon who sort of has this narcissistic bravado, but he doesn't actually have the skill and the intelligence to perform these surgeries, and he sort of botches all of them. And it was a really big podcast, and like night with all this stuff. But in watching it and like hearing all of like the true life stories, what you're saying is spot on. A lot of what the patients did was they didn't listen to their gut. They felt like something was off with the doctor, but they didn't want to push back. So I think that what you're saying is 100%, like, find a doctor that you trust and be willing to ask the tough questions and be willing to walk away and find a doctor that does check all the boxes, you know, even if you have to do a third or fourth opinion or consultation. So I think what you're saying is spot on.
No, absolutely. I mean, you know, when I used to train residents, the message I used to tell them is that you have to be very respectful. This patient's under general anesthesia. They're trusting us with her life. So we have to be very respectful. And as surgeons, we have to take on cases that we know that we're experts at. And as a patient, you have to find a doctor that you feel that much trust with. It's literally your life that you're trusting the doctors with. So I don't think this is something that they should take lightly. I encourage everyone to get at least a second opinion, just to get a feel of, I mean, what is someone, and ask that real difficult question. I can't stress how important that is. Ask your doctor point blank, are they an expert in that field? And if you're talking about a particular procedure, just ask them, how many have you performed? Okay. If they say 3, you know, that's not enough.
Not enough.
You know? Yeah, it's just not enough. A couple of hundred, maybe that's a solid number.
Yeah.
Okay. But 3, that's just not enough. So,
yeah, you'd be like a guinea pig for them. They're still getting their sea legs. And then also another red flag when filtering out the doctors is, like we talked about before, if the doctor defaults to the most expensive, most invasive option for what you are under, to me, that's a bit of a red flag. You know, why are they defaulting to what's the most expensive and what's the most invasive, when we should, you know, sort of try and start small and then escalate as needed?
No, absolutely. And I must say, probably for every 200 surgeries that I do, probably 1 I would have to use a large incision. 1 out of maybe 200.
Yeah.
So
what it could be. Yeah.
Right. Mm-hmm.
Yeah. Well, thank you so much, Dr. Wu. This was very insightful. And yeah, I learned so much. And I think a lot of my listeners, like we cover a lot of self-care and wellness. And I think a lot of them will start to sort of peel back that shame and stigma around asking those questions like, hey, why do I pee when I sneeze? Or, why do my vaginal lips look like this? Or maybe I should go talk to my doctor because, why is this protruding in my stomach? Maybe those are fibroids. And then now they're also empowered to know that they need to be their own best and first advocate, getting their own knowledge, going to someone that they trust, get second opinions, being confident enough to ask the hard questions, and really taking ownership of their health and their health care. Because it's a two-way street. The doctor has to be knowledgeable and compassionate, but as patients, we also have to be our own advocates as well.
Absolutely. I couldn't agree more. Thank you.
Yeah, absolutely. So everyone listening, you can find Dr. Steve Wu over in Newport Beach. If you want to give us more details, you certainly can, but they are all listed in the show notes that will be available with this episode.
Thank you so much for having me on the show.
Absolutely. And for everyone listening, be well, and we will see you next time. Bye, everyone.